Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, certified senior advisor, seniors real estate specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
Welcome back to another Senior Learning Institute educational moment. This is podcast 3 of 5 on Medicare insurance. As we noted in the first 2 Medicare podcasts, navigating Medicare insurance can be challenging, but it really doesn't need to be, and that's thanks to the help of licensed Medicare insurance specialists like Randy Schrupp. The best thing about Randy and his peers is that they've pretty much seen it all. You don't pay a penny more by working with them, and odds are great that they'll save you time, money, and aggravation. It's really a no-brainer. This podcast is designed to help you avoid paying a penny more than what you're required for when you obtain healthcare services, the services that you need. Randy, in an earlier podcast, you explained that Medicare Part A covers hospitalization and skilled care and is free to most of us. You also explained that Medicare Part B covers doctor's visits and things like physical therapy, chemotherapy, and in the year 2020, we all pay about $144.50 for it. So the question is, if Part A is free and Part B I'm paying a monthly premium for, am I done paying?
No, Ted, you're not done paying. When they designed the Medicare system, they wanted beneficiaries to pay a small portion of all the treatment that they received, because the concept was that if we had skin in the game, we would become prudent and intelligent users because we had to pay for at least something each time we received care. So the 3 main forms of cost sharing that they anticipated for us to handle was co-insurance, which is you pay a percentage of the cost of your care, a copay, you pay a flat amount when you receive a particular service, or a deductible, which we've already talked about, deductibles under Medicare Part A hospital insurance.
Okay, so with Medicare Part B again, so Medicare predetermines how much they're going to pay for the office visits and screenings and the durable equipment and all of that, and we're paying roughly 20% of that. Does that sound about right?
Yeah, that's fairly typical. The key is you have to understand, if you're going to pay a percentage of the cost, what percentage of what cost. Most hospital bills or most medical bills will come out. The top line is the reasonable and customary charge for the service that you received based on how it's coded. All right. So if the top line for a particular service is $600, say, that's reasonable and customary charge. The Medicare allowable charge is a published charge each year by Medicare for all the treatment codes that are available. And that's usually about 1/3 of reasonable and customary charge. So if you have 20% co-insurance, okay, for a $600 bill, that $600 bill is probably going to get satisfied for $200, and you're going to pay 20% of $200 or $40. That's your co-insurance. Co-pays are listed as flat amounts. You can see obviously what they are, and deductibles are usually listed as dollar amounts as well.
Well, it sounds like I got a break though, in that I'm only paying 20% of the Medicare negotiated number versus the customary one.
It's a huge break, okay, and that's what makes it the best deal in medical insurance, is that those Medicare allowable charges are so substantially, they're probably the lowest in the industry with any type of insurance.
Well, and I paid this copay every time I go?
Usually, yes. All right, so if you get, if you're getting, well, God forbid, chemotherapy, and you're having it 2 or 3 times a week, okay, over a couple of weeks, all right, technically you're going to owe 20% of the Medicare allowable charge for that chemotherapy each time you go. And so it can begin to add up when you get into severe medical conditions, substantially add up.
So if I'm sickly or think I'm going to need a lot of care, then this can get really expensive. But you and I've discussed offline that there's a cure for that. So tell us a little bit more about what the cure is.
The cure is basically, it's called either a Medicare Supplement or a Medigap Policy. Medigap makes sense because basically there's gaps in what Medicare covers. So the concept was you're going to buy insurance from a private insurance company to fill in the gaps left by Medicare. It's also called a Medicare Supplement because the Medicare amount that's paid to the provider, you can supplement what Medicare pays, by purchasing a Medicare Supplement / Medigap policy from a private insurance company to pay for those things that Medicare doesn't cover.
Okay, so what do these policies cost?
First of all, Medicare Supplement policies come in basically about 10 different versions. They're lettered policies. So you have a Medicare Supplement Plan A. Traditionally, the Medicare F supplement was the one that was most comprehensive. It kind of covered everything that Medicare didn't cover. It went away, and it's now, in essence, been replaced by a Medicare Plan G, Medicare Supplement Plan G, as the most comprehensive. Then there's other versions that don't cover pretty much everything that Medicare doesn't cover. So the first thing you're looking at is trying to decide how much level of coverage you really want. Traditionally, most people who buy Medicare supplement plans go with more towards the top of the line. So a G plan for a Medicare 65-year-old Medicare beneficiary in Missouri is currently probably about $140 to $160 per month. But it will basically cover everything that Part A and Part B don't cover, subject to a one-time $185 deductible for Part B.
Man, you keep charging me money. So,
well, yeah, that's true, Ted.
So these plans, and these are individualized, right? So if it's myself and my wife, then it's that number times 2.
That is correct.
Wow.
But what do you get in return for that? What you get in return for that is you have the portability of having original Medicare where you can use it anywhere in the country. Okay, if you go to Florida or you go to Arizona for the winter, you're blessed, and you can see any doctor down there. Okay, you know what your costs are because other than paying your premium for your supplement and that one-time $185 deductible for Part B, everything else is covered. So you can establish great peace of mind, okay, and a steady, you know what your cost is going to be from month to month, and you don't have to worry about getting, large unplanned charges.
Right, and there's certainly something to be said for that. But here's the question: you've got this alphabet soup, A through N to consider, and I get this book that comes in the mail, and my eyes start to water. So how do you help me determine what's in my best interest? And then if I miscalculate and don't get the right coverage, is there like a mea culpa, or is there a way that I can change that?
Yeah, you can change your plans. Most of the companies that sell Medicare supplement plans, you can make changes to them, initially. Frankly, 85% of the people that buy Medicare supplements, also known as Medigap plans, end up with currently a Plan G because it's the clearest, whatever Medicare doesn't cover, or whatever Part A and Part B don't cover, is going to be covered subject to that one-time Part B deductible of $185. So it's clean, it's clear, and compared to what other people, let's say 55 and above, pay for health insurance, it's still the best deal going in health insurance in the United States right now. So if you're getting that kind of comprehensive coverage for $150 to $200 a month, you're doing quite well.
Right. So, this is where you really shine in regard to how you help us go through this. So, typically if, I'm getting ready to start Medicare, how do you and I kind of interact, and how do you coach me through this?
Well, I always start out by basically trying to explain the whole system, as we're doing in all your podcasts, trying to help people understand all the options that they have. All right. And then compare and contrast. What's the difference between a Medicare supplement and a Medicare Advantage plan? I usually try to get some basic idea of their health conditions, because if I'm dealing with someone who's a incredibly healthy 65-year-old, runs 5 miles a day, 5 days a week, and doesn't take any medication, that person has a different set of needs than a person who has diabetes and congestive heart failure, has 6 medical specialists and everything else. Now, I don't try to delve into where I don't need to know every little detail about your health to be able to give you some good advice. But I'll basically put that into my calculation as I sit there and begin to guide you to where I think you'd probably be most happy. You're in charge. I'm not going to sell you something that you don't want, but bottom line is all of that information in that discussion helps me guide you to an area where I think you'll be happy with what you have.
Right. And I think where you really shine, your true value is really comes in when it comes to prescription drug plans, which we'll talk about down the road. So let me ask you this, though, because there's like a bunch of different insurance companies that offer all these plans. Are they all offering the same product, and they all offering them at the same price?
Yes. Here's the situation. Medicare supplement plans are regulated by each individual state. They're typical insurance. They're not regulated by the federal government. So the state insurance department in Missouri regulates the sale of Medicare supplement plans. There's about 60 companies in the state of Missouri that sell Medicare supplements. All right. In order to make it all possible for beneficiaries to evaluate, in order to sell a Medicare supplement plan, it has to adhere to the guidelines that the federal government puts out in terms of coverage. So if you buy a Medicare G plan from United Healthcare, it's the same G plan that you will buy from Mutual of Omaha or Aetna, all right? The only difference is the premium that you pay and the customer service that you receive. So when you go shopping and looking at all your options, an A is an A G is a G, an N is an N, and a K is a K. All right. And you look at the coverage, and that comes out in the book that is sent to you when you first turn 65 to explain what's covered and what isn't covered by the various Medicare supplement or Medigap plans.
But you said the plan is the plan, but the price is not always the price, right? It differs between insurance companies?
That's absolutely true.
Okay.
As does the customer service.
All right. So let's just say, for instance, I decide to buy policy G through ABC insurance carrier because they're $25 a month less expensive. And then a year down the road or 6 months down the road, whatever it is, ABC insurance company decides, heck, we're not going to cover that anymore. We're leaving the state of Missouri. What do I do?
If they were to leave the state, okay, you automatically have a special enrollment period where you can actually replace it with another company.
If my health has changed in that period of time, is there any pre-qualifications or anything I need to be concerned about?
When you first turn 65, you can purchase a Medicare supplement plan with no health questions. It's called the guaranteed issue period, and it commences 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months thereafter. All right, and during that, that's your initial enrollment period. Guaranteed issue lasts for 6 months after you first become eligible for Medicare. So if you decide to enroll in a Medicare supplement plan, you can enroll and they don't get to ask you any health questions. After that period, if you have to change, they now have the opportunity to subject you to medical underwriting, which means asking you health questions, which could impact whether or not they're willing to take you, or B, impact how much you pay for the coverage.
Wow. All right. So if I think I'm going to outsmart the system and don't take the coverage, and then I have a change of health after that period of time, I can really put myself in a bind if
That
my
is
health is.
true. That is true. And I always advise people, you know, there's really, you know, that's not a wise move.
Right. I mean, sometimes the budget dictates and I can only do what I can do. But if it's a choice that I have to make between the new car and putting the insurance in place, it seems like I should be seriously considering putting the insurance in place versus the new car.
Absolutely.
Okay. All right. So now I'm covered. I've got A and B, and now I've got a Medigap policy in place. No more hidden costs, right?
Well, you still have to deal with prescription drug coverage.
Oh yeah. Okay. All right. So let's do that for our next podcast, because I need to let a lot of what you just told me sink in. So we'll come back and we'll do that one at another time. So let's just kind of review where we are. We're going to recap. So we've covered Medicare A and B.
Right.
We just covered Medigap insurance. In our next podcast, we're going to talk about Medicare Part D, which is for drug plans. And then we're going to finish up by going over the Medicare Advantage plans, which are quite popular, yes?
That is correct. They have become the fastest growing segment of the Medicare market, and currently about between 35 and 40% of Medicare beneficiaries in the United States receive their benefits through Medicare Advantage plans.
Right, but as we're going to learn, it's appropriate for some and maybe not for others. Is that fair?
That is absolutely fair. That's why if you're dealing with a reputable broker, okay, they're going to show you the pros and cons of having a Medicare supplement as opposed to an Advantage plan, and vice versa, and basically allow you to decide what's best for your situation. Once you understand what the differences and similarities are, and then you make the choice.
Is it fair to say, Randy, just to kind of tease, that once you start going down that Medicare Advantage path, that gate behind you kind of closes when it comes to original Medicare plans?
Yes, that's a fair statement. All right. It's not complete. The door isn't slammed shut. You can move back. And every year I take people out of Medicare Advantage plans and put them back into Medicare supplement policies. It's not completely necessary, okay, and it becomes costly because once you get past that guaranteed issue period, if you have medical conditions, the insurance companies can rate you up, and it can be substantially more expensive.
Right, but you also just kind of hinted to the fact that having annual reviews and at least discussions by phone makes all the sense in the world.
Every year we have open enrollment for Medicare between October the 15th and December 7th. So it gives every Medicare beneficiary an opportunity to rethink and review what they've got and whether or not there's something else better in the market.
Yeah. Is it fair to say that it's best to schedule those appointments early?
It is. There are usually lots of meetings that you can attend, public meetings where they'll discuss various things. But yeah, schedule early is a good plan. Yeah,
really important. I know you get really, really busy, and some other folks that I know that do what you do, just like it's like, don't even bother to think that I'm going to be at a meeting or do something, because I'm servicing my existing clients and maybe taking on a few more. So it pays to really get yourself scheduled with Randy early, so that you know that you're going to be taken care of. All right. Well, Randy, thank you very much for your insight. We appreciate that, and we look forward to our next discussion. In the meantime, if someone wants to get in touch with you, what's the best way for them to do that?
They can either call me at 314-496-0140 or email me at Randy_Schrupp, that's SCHRUPP, at MSN.com.
Wonderful. And traditionally, this is at the time of the podcast where I'd like to thank you all for listening to this Senior Learning Institute educational moment. At the Institute, we strive to provide straightforward and unbiased information, the information you need to make smart decisions the first time. We connect older adults and their advocates to the resources they need, from helping them stay put to selling their home in any condition, estate and financial planning, care providers, estate sales, clean out services, you name it, anywhere in the U.S. We also help folks who have homes to sell anywhere in the country find a qualified agent that's near them. It's a free service. So we're here to help you with that as well. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute.